I'm a registered nurse, so I know the symptoms, but I always thought in my mind that you had to have a family history of diabetes, and I don't know where I picked that up from, but it stuck with me. So I was having all these symptoms, and because I had no known family history at the time, I just attributed all those signs and symptoms to other things that were going on in my life.
What
Um,
were those signs and symptoms?
so I was tired all the time,
Mm,
all the time, but I attributed that to being a med surg nurse, working 12-hour shifts. So I felt like I had a right to be tired, but I was
right.
extremely fatigued all the time.
Mm.
I was thirsty all the time, and people would say, "You drink a lot of water," and I just thought that was a good thing. Thirsty all the time. I did have frequent urinating, but again, I thought I had a nurse's bladder because we hold it all day, and then after so many years, it kind of catches up with you. So, the I had blurred vision, um, intermittent blurred vision. So I just thought maybe it's time for me to start wearing readers, that kind of thing. So I could
So,
attribute all those signs to other things.
can you go in depth more about that blurred vision? What, I mean, was it really like an instance of just a little blur, or was it like, wow, all of a sudden I really can't see well? Can you describe that?
It wasn't for me. It wasn't all of a sudden, but there are cases of people who get blurred vision. I never, because I didn't think it was diabetes. Until afterwards, I would notice when I ate something that was high in sugar. After I ate it and it started digesting, my vision would get blurrier. But at the time, I didn't think that I had diabetes, so I wasn't associating the blurred vision with what I was eating at the time. So it was gradual. Um, as a matter of fact, like I said, I just figured, it was time for me to start wearing readers. And that wasn't the case. And so this particular day, I was on the unit passing medications, and I just lost my vision. So you can just imagine how hysterical I was, and some coworkers brought me down to
So
the emergency.
you were at work
I
doing
was
your
at
job,
doing my job,
day to
and
day things.
I had blurred vision earlier on, and it had been a little worse. Um, the few days before that, the blurred vision had gotten worse, but again, I did not associate it with diabetes.
And you say you lost your vision that day.
I
Where could
just
you, what did you
it
see? It was black or
no, it was so blurred that I couldn't see anything.
oh, okay.
I don't know how to. I really, it's hard to describe, but it was so blurred that I couldn't see anything. So of course, I was terrified, and medicine went everywhere. So coworkers took me down to the emergency room, and so when I started saying everything, the same thing, um, they checked my blood sugar. My blood sugar was 1147, and that was like almost unheard of, to have a blood sugar over 1,000 and still be alert, and able to
Wow.
so they didn't waste any time. They put me on the insulin drip. It took a few days for my vision to come back. And so they were like, "Yeah, your A1C is 14.7. You have diabetes." And I was like, "What? What are you talking about?" But
So give our listeners an idea of what a normal insulin level should be. You said yours was 1147, 1147.
that
What
was my blood sugar.
what is considered within the normal range?
So normal, non-diabetic, normal blood sugar is less than 100.
So you were more than 10 times higher than the normal
Yes,
range.
yes,
And
yes.
you were still walking and talking and breathing and wow.
So, what now that I understand, um, more than likely for me to get that high, because that just doesn't happen. So, for
Mhm.
me to get that high, I had to have had diabetes for some time for it to gradually continue. Because you don't just go from normal to 1147. Or a normal non-diabetic A1C is less than 5.6. You don't go from 5.6 to 14.7
More than
instantly.
double, right? So,
So
is there a way to detect how long you may have had diabetes before it went diagnosed?
they can't really tell. You can there's a blood test to test your insulin level, but it can't tell you how long um, that you were not producing enough insulin. No, there's not a test that can tell you that.
Hmm. So, when you were at work and you could not see, all of a sudden days went by, right? Where you could not see. It wasn't just like a instantaneous thing. You can see, and then an hour later you're better. This went on for days, right?
It took it after 3 days of being on the IV insulin. Um, my vision started to slowly coming back.
So, what were your thoughts when you had blurred vision? You were, doing fine, and all of a sudden you couldn't see. What was going through your mind emotionally during that
Oh my, oh my God! I can't begin to tell you um, those days. You talking about begging God, if you please just let me see again.
time?
Not knowing, knowing as a nurse the complications of diabetes. I've taken care of diabetics and the patients who are usually admitted in the hospital with diabetes, or patients who are suffering from the complications of diabetes. So I've taken care of patients, young patients who've lost their vision to diabetes, who've had to have amputations, who've had to get on dialysis. So I really thought it was over for me, because again, for me to be that high at that time, I probably had diabetes for some time. So now I have this serious complication, and I wasn't sure if I was gonna recover from that. So yeah, it was a devastating time for me. I thought my career, if you're a nurse, you got
Wow.
to be able to see. So I
Right.
got all these thoughts of my career being over. Hadn't been married a long time, so I was just thinking all
Oh,
these things. How this would just turn my life upside down if I were not to gain my vision back. So yeah, it was devastating. It was devastating. Yeah, it was a very hard time. But again, um, begging God, please,
yes.
please, just let me live. Show me what to do. I'll do it. Yeah, it was very. It was a pivotal time in my life.
Mhm.
Hmm.
So, you're a type 2 diabetic.
Yes.
And had you had a lot of information about diabetes through your family? Did you see people that, in your family that were living with diabetes, or had they talked about that at all?
No. So that was the reason why I didn't think I had it, because I knew of no one in my family that had it. But of course, when I got diagnosed, it was like, oh, cousin so and so, they have a touch of sugar,
Yes, I forgot about that. They used to talk about a touch of
yeah,
sugar. That's right.
and in our culture, especially in the generations before me, people were very modest about their illnesses. So, and I had a very prideful grandmother and great grandmother who wouldn't dare tell anybody they had any kind of physical condition. And I'm like, I can't believe. So of course, when I got it, then people start saying, well, this person has it, this person has it. I'm like, this is information we should be sharing, because it could have been completely prevented
Right.
had had I known, there was a family history, but then I learned you don't necessarily have to have a family history of it, and still get it. But having a family history of it puts you at a higher risk for developing diabetes. So it would have helped to know.
Yes, definitely. So, um, as you know, you were diagnosed with a reading of 1147, like probably almost record breaking, a really,
Hmm.
really high number.
Back
How
then.
are how are your numbers now?
I am so blessed to say I do. I live in a non-diabetic state, and what that means, and I definitely want to be clear. There is no cure for diabetes. Is it okay for me to kind of explain that, kind of
Yes,
set the stage?
please.
Okay, so we don't get diabetes from food. We get diabetes because we're not able to produce enough insulin, and there are a lot of factors that put us in a place where we can develop diabetes. Of course, family history that I said, environmental factors, carrying too much weight around the middle. If you ever smoked, though all those risks put you in a higher category for developing diabetes. Um, so to be diagnosed with diabetes, if you're A1C, and that's the diabetes blood test that we do, and what it does, it measures how much sugar is collecting around the blood cells. Okay,
Mm,
because sugar, we need sugar, we need carbohydrate. That's our fuel, just like gas for a car. But just like gas for a car, you gotta fuel has to be in the tank in order to make the car work. Well, sugar works for us, or glucose works for us inside the cells. The only way sugar can get in the cells is with insulin. So when we don't produce enough insulin, sugar under no circumstance can cross a cell barrier without insulin kind of unlocking the door to let the sugar in. So if you don't produce enough insulin, sugar can't get where it's supposed to go. So sugar collects around the blood cells. The hemoglobin A1C, the diabetes blood test, measures how much sugar is collecting around the cells. And because our cells live about 120 days, we can tell what your blood sugar has run on average for the past 3 months. So that's where that comes from, because your blood cells die and you regenerate new blood cells.
hmm
So uh, uh, to be diagnosed with diabetes, if you're A1C, that 3 month blood test, if it's 6.5 or higher, you have diabetes. Pre-diabetes is 5.7 to 6.4, and the non diabetic state is 5.6 or less. Now, I live in a non diabetic state. I keep my A1C under 5.6. So technically, and I'm just, whoop, whoop, my last one was 5.3. Um,
Oh, wow.
yeah, I can say I don't have diabetes, but the problem is with our ability to produce insulin. So those cells that make insulin, those beta cells that produce insulin in the pancreas, those cells are like your fingers. You're born with all you're gonna get, and we
Okay.
can't generate new ones. So just like I have 10 fingers, if I get in a car accident and lose 2 fingers, I'm not going to grow 2 fingers back. And I love the Lord with all my heart, but I'm going to just be loving God with 8 fingers. So I can't regenerate new beta cells. So my ability to produce insulin, and I'm just going to say my ability to produce insulin is here. I can't change that. But insulin only responds to sugar. So if I can't change the insulin level, then if I reduce the amount of carbohydrate that I take in, I still can have a normal blood sugar. Your body needs the amount of insulin for how much sugar you take in. You take in a lot of carbohydrate, your body needs a lot of insulin. You decrease how much carbohydrate you take in, it doesn't matter if you don't make a lot of insulin. So I know I have diabetes. I was over 6.5. So I'm not able to produce a lot of insulin. So I have to watch how much carbohydrate I take in. I have other factors, affect your blood sugar, stress, those kind of things. Um, Cause a reaction and make your blood sugar high. But food is the biggest part. Our food and our lack of food affects blood sugar. So if I decrease how much carbohydrate and sugar I take in, it doesn't matter if I don't make a lot of insulin. So the process of learning how to manage um, manage blood sugar was me learning how my body metabolizes carbs.
Okay.
And so as I decrease how much carbohydrate I take in, of course, my body doesn't need a lot of insulin. So I'm able to manage and keep my A1C in a normal level because I don't take in a lot of carbohydrate. Now,
So that's amazing. Like, one of the reasons that I wanted to do this series is to give people hope and to inspire them that if you do, have diabetes, no matter how bad it is or how high your sugars have been, um, you can do things to try to make it easier and better. I guess, if they, people have high numbers or high glucose readings, I should say, um, it's discouraging. But like you said, you had to learn how your body processed carbs. I think that was key. Um,
right. I think, Dorchelle, the biggest thing that saved my life when I got diagnosed, of course, my A1C was extremely high. And my doctor told me, Val, you have to get on insulin. And I was like, no way. Because, of course, in my mind, me being the nurse, people that get on insulin have to stay on insulin the rest of their lives. So, and I see all these people still taking insulin, but still having all these complications. So I'm like, no insulin. He said, Val, your A1C is 14.7. You're not making insulin. So if you go ahead and take this insulin now, we're not getting on pills because pills provoke the pancreas to pump out insulin. So you got to be able to make some in order for the pills to work. But there's such a stigma about taking injections. People don't want to take the insulin. He said, but if you take the insulin, what it'll give your pancreas a chance to rest and build up some good insulin. He said,
wow.
and this is what changed my life forever because I had never heard this before in all my nursing career. He said, but I'm going to tell you something. How long you stay on insulin is up to you. I was like, what? He said, oh, you're going to see how long you stay on insulin is up to you. And I later on, while I was taking the insulin, because it was just so overwhelming, I just got tired all of a sudden. And I realized while I was taking I went ahead and agreed. And while I was taking the insulin, I see why people get stuck because I realized, okay, I want to eat that cake, take a shot. I want to drink that soda, take a shot. And then you look up 10 years later, you're still taking shots so you can eat what you want to eat. And that's not how to manage uh, diabetes. So I was on insulin, I think 4 months, 4.5 months. And I was able to wean off. And then I did get on 2 oral medications and, just had ups and downs. Just, you get tired of it, take breaks from it, that kind of thing. So I had a lot of ups and downs with it. But eventually, I decided as I learned more, I realized I could manage diabetes with diet and exercise. So yes, I went from insulin to pills to now I manage diabetes with diet and exercise. And since 2008, I've kept my A1C under
Wow.
5.7.
So, to
Yeah,
those who have just now joined us, we have Miss Valerie Burton here. She's an RN and she's a type 2 diabetic. She just told us that when she was diagnosed with diabetes, her blood sugar glucose level was 1147. The normal reading is under 100, correct?
correct.
And so she was told by her doctor to initially take the insulin to give her pancreas a rest. And that is something I had never heard of explained like that. It is your body isn't making enough insulin. Here's some support for your body to heal and to rest and get to where it can do what it was meant to do. And now she's not taking any medications to manage her diabetes. I mean, she went from skyrocketing numbers to now just managing it well. And I mean, granted, you are a diabetes specialist, so you're very well educated on how this works. Do you think that it takes a lot of education and knowledge in that way to be as successful as you are?
Not necessarily in the studies that I've had. I went back to school because I started struggling with managing diabetes, and God opened doors for me to be able to go back and specialize in diabetes. But what I have learned, a lot of people just don't know, because after I learned what I learned, and I was like, why aren't our doctors telling us this? But it's such a specialty. And, so because of course I immediately went back to my primary care. I was like, look, this is what I learned. Why didn't you tell me? He was like, Val, I didn't know that. That's not my specialty, so there is a lot to know, but it's, you don't have to specialize in diabetes to be able to manage diabetes. There are some key things you need to know, and some myths that are out there that you need to just dispel. Number one, unfortunately, the way our body is created, just like I explained about the cells in your fingers, once you cross that line, you have diabetes. I have diabetes, even though I've been in a non-diabetic state since 2008. According to my numbers, my A1C is 5.3. I could say I don't have diabetes, but my ability to produce insulin didn't change. What I changed was how much sugar I take in.
Okay. So you're not in a diabetic state.
Oh, eating habits. Going to happen. My blood sugar's going to go up because I don't produce a lot of insulin. So that doesn't change. And so I think once we come to terms with having it, that's your first step in living well with the diagnosis. Okay. So I have diabetes. I don't produce enough insulin. And what it helps me do, it helps me make better choices. So now I look at things and I go, Val, you don't make enough insulin for that, so don't even go there. And now
you have to get your sister girl on to tell yourself not to eat that cake.
And now I've gotten to a point, because I've seen the devastating effects of high blood sugar. I could have lost my vision. Yeah. I could be blind today. So there are certain things that you can't even tempt me with. Like, you can't bring me a piece of Walmart cake. I'm not eating that. To me, that's garbage. You can't pay me to drink a regular soda. I'm just not going to do it because I love me. Right. And that's what I was addicted to. Addicted to soft drinks. Well, being tired all the time, having the sign of high sugar, I was trying to quench the thirst with water and Coke. So I was drinking 3, 4, 20-ounce Cokes, trying to keep my energy level up, not knowing that it was a high blood sugar that was causing the lethargy anyway. So yes, what we know is going to help us. And like I said, the first thing is just to deal with the diagnosis, and that's the first step to freedom. I think the second thing that you have to do it and it's hard work. It is. I decided, okay, I'm gonna take 3 months out of my life and focus on managing this. Another thing I learned, about testing your blood sugar, once you're diagnosed, before you eat, your blood sugar should be less than 110. 2 hours after you eat, your blood sugar should be less than 140. One of the things I learned while I was specializing in diabetes, the what causes most of the damage to our blood vessels that causes the complications of diabetes are the blood sugar spikes. Your blood sugar gonna always come down. It does. It's the spikes that damages your cells. What I learned was that a meal, no matter what your blood sugar is running, a meal shouldn't make your blood sugar go over 50 points. So this helped me even when I was high. So, when my blood sugar was very high, it took time for it to come down. So I was with the A1C of 14, I was waking up in the morning with blood sugars in the 200s, and I hadn't even eaten anything. So of course I would be discouraged. And I go, I better not eat. Blood sugar's already 200. Well, I learned later on that when you skip meals, your blood sugar goes even higher. It makes it worse. So even though my blood sugar is 200, I still need to eat breakfast. But whatever that meal is should not make my blood sugar go over 50 points of what my pre-meal blood sugar is.
So
So
how do
that
you
meal,
determine if a meal will make your blood sugar go up 50 points? Like, have
you
you just learned over time, or
you have to go through it. You have to go through the process. Number one, all of us metabolize sugar differently.
right?
Number two, so we give guidelines. We tell ladies you shouldn't have more than 30 to 45 grams of carbs per meal, and that's just to get you started. Because again, everybody can't eat 30 grams of, of of carbs that's in rice. That might be
Right.
too much for them. So you take those guidelines. So we tell ladies 30 to 45 grams. Men shouldn't have more than 60 grams of carbs per meal. So test before the meal, test 2 hours after. If the difference between those numbers are less than 50 points, that's a good meal. So even if you're running high, as you continue to have meals that don't make your blood sugar go up 50 points, your overall blood sugar starts to come down. That transformed my life. So there were two things I always had with me. I had measuring cups and I had my meter. And it got to where I wanted to know. So I would test before and 2 hours after every meal just so I can start to learn food. And as time went on, I learned certain combinations of carbs. Even if I'm eating the right portion that my meal plan says I can have, the way I metabolize it, it may make my blood sugar go up. Like I can't eat beans and rice together. It's just the way
Too much
I break it
carbs.
down. It just makes my blood sugar extremely high. So guess what? I learned how to eat beans without rice, and I'm good.
That's very important in New Orleans. I remember I
Definitely.
visited a friend, and I tried to eat just the beans with no rice, and it was like, what is wrong with you? You can't not, have the rice with it. So I'm sure people bother you about that a lot.
Yeah, but they're learning, especially people with diabetes.
Right.
Sometimes it's not worth it. Yeah.
Definitely.
So
So
yes, it's a learning experience, but it takes time.
do any of your patients have success with one insulin versus the other, or one method versus the other, insulin pump versus injections? Do you see more success in one form versus another?
Well, they both work. I'm a fan of pumps. Um, I've seen lives change when they work, especially people who deal with low blood sugars, frequent low blood sugars. Having an insulin pump really help them. Some people don't like things attached to them. I see a lot of young type 1 diabetics, and they have issues with cords and carrying around this little box that looks like a beeper kind of
Yeah.
kind of thing. But now we have pumps that you wear. It looks like a little tab that you wear in the backside of your arm. So there are a lot of new uh, forms of delivery of insulin. But what I like about the pump is if I'm having a low blood sugar, I can cut the pump off and it's going to stop. The insulins, once you take that injection, especially like long acting insulin, you can't get it back. So you have to deal with the consequences of the shot.
You have more control over the pump, it sounds like.
And then you can be more liberal with what you eat because all you have to do, you can eat what you want, you just got to make sure you take the right amount of insulin for it. So that's
So
the advantage of having a pump.
so when your patients come in, right, have they, I'm assuming they've already been diagnosed with diabetes before you see them, or do you actually get people there to be diagnosed?
No, they're diagnosed either with pre-diabetes or diabetes when they come to us. They're referred by their physicians.
And would you say that people um, have a hard time understanding what is needed to be done, or is it just it's a hard change in lifestyle? What do you think is the most that you see?
I think it's both. Um, I think it's both. I'm amazed at how many people struggle with the diagnosis and they have immediate family that are suffering serious complications with diabetes. I have patients, that come in with high A1Cs like mine was 14, 15, 13, and they're like, "Oh, yeah, I know how to do it. My mom, she's on dialysis. My uncle, he got both his legs cut off." And it's just kind of matter of fact. And and I tell them, that does not have to be your story.
Right.
It doesn't have to be your story. So it's that. Um, it's hard, especially in the area that I live in culturally. Food. We use food to show you that we love you. So when I make a cake for you, I'm telling you how much I love you. So life, we're like food capital here in New Orleans, so it's a huge challenge, and I can't tell you how many times um, I hear every day when I tell them this is how much rice you should have with the meal, and they look at me, "Are you kidding? I was raised on rice." And I said, "Well, yeah, you were raised on it, but you can die from it too if you don't make some changes." It's tough because food is necessary. We have to have it, and I think what I've observed over the years of being a diabetes nurse is it's probably the one thing that we do have control over. You get to choose what you want to eat.
Yeah.
So.
That's amazing. So what I want to do now is I want to present just our credits and thank yous to our audience, and then we'll come back. Audience, while I'm presenting the credits and the thank yous, please type your questions in the comments, and we're going to take some questions. Okay, everyone, we are back, and we have a few questions. I see. Um, we discussed management of diabetes from your standpoint. You're type 2 diabetic, as well as you are education, specialist, certified diabetes care and education specialist. Um, and so you meet people with type 1 and type 2 diabetes. Um,
Yes,
and you would agree that the management and approach may be very different, but all need to kind of care for their how they eat and how they exercise, correct?
correct. There is a difference between the two. People with type 1 diabetes used to be known as juvenile diabetes. You usually develop it very young as a child, but there are a number of people who can get type 1 diabetes, though. To clarify that, type 1 diabetes, um, you're not able to produce insulin at all. So people with type 1 diabetes have to take insulin the rest of their lives, because we can't live without insulin. People with type 2 diabetes, we're able to make insulin. We either don't make enough insulin, or the insulin that we do make doesn't work properly. Now, the type of medicine that you take does not dictate the type of diabetes you have. There are many type 2 diabetics that need insulin. Like, I had to take insulin. My pancreas was still working. I just wasn't producing enough insulin. So I had to take insulin um, to supplement. So, but people with type 1 diabetes are not able to produce insulin at all. So they do have to take insulin all their lives.
Thank you. And so we have another question. Um, Ambria Mikolajczyk says, how can family members help their loved ones manage diabetes? So how can we be a better support?
I would encourage you, first of all, I would encourage you to attend education classes with your family members who have diabetes. The more support you have, the easier it is to manage. And I tell families this all the time, especially people who have children. If the parent has diabetes, the children are at risk for developing diabetes later on in life. And what better way than for the family to come together in support of that parent, and as a family unit make lifestyle and diet changes to help that parent who has diabetes, and to help the children not get it later on in life. It's easier to help children or have children make diet changes when they're small, because you have control.
That's true.
When I got diagnosed, they were forced to support me because I cook. I'm not gonna cook two different meals, so this is how we're gonna do this. And we need to do this because if I have diabetes, you can get it too if we don't do something different. In order to have change, you have to do something different. So I would definitely start with attending education classes with the family member that has diabetes. What's good now, most insurances pay for diabetes education. We even validate parking here. We just want people to come, because it's so important for that person who's diagnosed to have support. It's not fair if I'm eating baked chicken and everybody else sitting around eating fried chicken. It makes it that much harder for that person. So yes, go to classes, diabetes classes with your family member. Ask them to teach you, because what most of my patients, the reason why they don't want the family to come, because they think the family is going to turn into the food police, and so as soon as they see you eating a small portion of macaroni, they go, you're diabetic, you're not supposed to eat that, so they
Yeah.
have that dynamic going on, and so they feel isolated, they get discouraged, and that's where a lot of people just kind of give in to it.
We have another
Because
question
go ahead. I'm
from
sorry.
Andrea Ingram Hampton. She says, "What do you think about intermittent fasting?"
Um, that it's I personally, um, as far as health reasons, if you have diabetes, I don't think it's a good idea.
Mhm.
If you have diabetes, what a lot of people don't know, and that's where all this information that's out now has us so confused. I know I said earlier, we can't live without glucose. Sugar is our fuel. Carbohydrate is our fuel. That's your brain works on sugar, so we need it. So we have this protective mechanism because your brain works on sugar. We have a built-in protective mechanism that when you don't take in carbohydrate, your body breaks down fat, and it happens in the liver. Your body breaks down fat to turn it into sugar to keep your brain working. And so that's why people love this keto thing, so you eliminate the carbohydrates. Yes, you lose weight. Yeah, because your body's breaking down fat to turn it into sugar. Now, people who don't have diabetes, you can skip meals. You're going to be fine. You can fast, you're going to be fine because your body's going to do what it's supposed to do. The liver's going to break down fat to turn it into sugar. The problem comes with people who have diabetes. Our problem with diabetes is we don't produce enough insulin. So when you skip meals, you're not taking in any carbohydrate. Your body does what it's supposed to do. It breaks down fat to turn it into sugar, but you don't make enough insulin to take that sugar where it needs to go. So you have high blood sugar if you don't eat, and you have high blood sugar if you eat too much. The danger in that is when your liver is breaking down fat to turn it into sugar and you don't produce the insulin to take it away, you start to build up ketones in the blood. That affects your kidneys. We already have diabetes. It's already affecting our kidneys just being diagnosed with diabetes. Now we're skipping meals, we're eating meals that don't have carbohydrates, but we don't make enough insulin for the sugar the body's making. And so you still end up with high blood sugar. So fasting, for the person that has diabetes, I don't think it's a good idea.
Well,
There are a lot of views out about that, and that's just my view.
well, thank you so much for spending some time with us today and allowing us to hear your story, um, and to share. Once again, I'll recap some of the things you said. She's a type 2 diabetic. She's an RN. She has a wonderful list of accomplishments, published author for health magazines, a lot of things, but she has type 2 diabetes herself. The day she was diagnosed, her vision was blurred. Her blood sugars were 1147. Um, but she's type 2. She was able to make some changes and do very well. So to those out there who are living with diabetes, just know um, there's hope. There's hope to just
Yeah.
keep going on, no matter if you're type 1 or type 2. Just keep fighting the good fight. And I just want to thank everybody for tuning in with us today. Tomorrow, we're going to be right back here at 7 o'clock with Dr. Raina Alexander, and she's going to present us with some cold hard facts about diabetes. So I'm glad to see the chats today and everybody just kind of building camaraderie and sharing their experiences. Thank you for your questions, and please share this information. Do you have any final thoughts?
I would just say that if you are diagnosed with diabetes, you can live well.
Yes, I love that. Well, good night for now. Thank you, everyone. Thank you again. And we'll see you tomorrow right here at 7 o'clock.